Hello, I'd like to talk to you about arthritis at the base of your thumb. So what happens when you have arthritis in the base of your thumb is that you can see by this diagram here, in this model that we have here, that the cartilage gets eaten away by the disease process. And then what happens is that ends up being the bones are grinding against each other, and that's what causes all the pain when you're doing stuff. So the bones end up going into each other like this whenever you're doing something, which then causes a lot of pain. That then consequently causes instability, and then it can actually cause your joint to dislocate while you are doing things, and it can eventually wear that way. So you end up kind of like this model here, and then it comes in like this, and so this part of your thumb starts to bend backwards to try and compensate while this one goes in. So you can't actually open your hand to be able to open up to grab a cup of coffee like you normally would. So it can be quite detrimental, and then it can also be very painful. So that bone grinding against bone, that continues to make things worse. And then every time it happens, it causes pain, but it actually causes inflammation, and then it actually can encourage more osteophytes to form, which is extra bone growth. And so that's why you can see sometimes when people have arthritis, they have little bumps and things that are poking out that are very hard. That's what we call osteophytes. So it's essentially kind of like bone formations, extra callus formations. So if we can manage the pain, then we can actually slow down the progress and stop it from getting worse.